the temporary halting of U.S. operation, or rather U.S. foreign aid, has had global resonance, including for South Africa. The President of the United States, Donald Trump, signing an executive order on January 20, issuing a 90-day pause on all disbursements of foreign aid. In South Africa, some U.S.-funded healthcare programs, particularly related to HIV treatment rollouts and clinics, they've temporarily closed their doors to patients following this particular directive. Our reporter Latashia Naidoo is in Cape Town, and she joins us now. And Latashia, good afternoon to you. There has been this wide reaction globally, particularly for programs that are funded by the United States on the back of this pause on foreign aid. Do we know what the stance of the U.S. government has been since the signing of that executive order? Are they dialing back a little?
Good afternoon, Xoli. Well, some good news, I would say, in this fast-moving story. We know that President Trump signed that directive, that executive order, on the 20th of January, halting all U.S. aid. On the 24th of January, there was another order, a stop-work order, halting anyone participating in these programs from actually continuing working at various clinics, organizations, forcing them to close their doors. But as of today, the 29th of January, and just right now, there's been a statement issued by UNAIDS stating that earlier today, Marco Rubio, who is, of course, the U.S. Secretary of State, issued a directive saying that the U.S. would be dialing back on its freeze on aid related to humanitarian relief and urgent life-saving medical care. And UNAIDS have just released a statement now stating that that life-saving HIV treatment and the PEPFAR programs, which it has been rolled out in 55 countries across the world, benefiting 20 million people who receive vital HIV treatment as a result of the President's emergency plan for AIDS relief, including in South Africa, where that program has been running since 2004. Treatment will resume as a directive from today that's just been issued in terms of humanitarian relief and medical care. And it's of course caused a lot of concern, a lot of controversy, particularly from a number of healthcare providers. Xoli, I visited a few clinics and organizations, NGO-based, across Cape Town today, which had to close their doors following that executive order on the 20th of January, and again the stop work order on the 24th of January. And today those doors were still closed, but now we know that as of this evening, I can confirm that those treatments, the UN aid for those treatments will be resuming according to UNAIDS. And also earlier today, our health minister, Dr. Aaron Motsoaledi, also allayed the fears of concerned South Africans who were worried about where they'd be getting this life-saving antiretroviral, hormone replacement therapy and PrEP medication from, with these clinics closing. And Dr. Motsoaledi stating that while the U.S. did provide a significant amount of funding for HIV treatments and programs in the country, the majority of funding came from the South African government, from the Department of Health and other donors. And this is what the health minister had to say.
The 17% of PEPFAR is about 7 billion, or maybe I didn't give you the total amount which we are spending on this program of HIV. Those who were at Lituli House yesterday, I said it's 44.4 billion. I'm sorry, I'm apologizing. They gave me last year's figure. Now it's 46.8. It's 46.8 billion for now, and for the next financial year is going to be 48 billion. Now I'm apologizing. Whoever gave me the figures gave me last for 23-24 financial year. Now I'm talking about 24-25. Is 46.8 billion. Now, in that 46.8 billion, 17% of that comes from PEPFAR.
Latashia Naidoo reporting for us there in Cape Town. Let me also give you a quick reminder, just some of what the Health Minister had to say, and that is that our own National Treasury would possibly have to step in and almost be the stopgap measure where the US foreign aid would have fallen short. All right, Latashia Naidoo, let's pause it there for the time being. Thank you very much for that update.